In the management of non-ischemic heart disease, exercise testing has evolved from a tool for ischemia detection to a sophisticated method for functional phenotyping, hemodynamic unmasking, and prognostic stratification. For a clinician, the utility shifts toward evaluating the heart's integrated response to metabolic demand. In hypertrophic cardiomyopathy, exercise testing, particularly cardiopulmonary exercise testing or CPET, is essential for identifying patients at risk of heart failure progression rather than just sudden cardiac death. Prognostic thresholds. A peak oxygen consumption PVO2 of less than 14 ml per kg per minute or less than 80% of the predicted is a robust predictor of adverse outcomes, including heart failure hospitalization and the need for transplant. Hemodynamic unmasking. Exercise stress echocardiography is used to detect latent left ventricular outflow tract obstruction. A gradient of 50 millimeters of mercury or more during or immediately after exercise is clinically significant in symptomatic patients with resting gradients below 30 millimeters of mercury. SCD risk stratification. The presence of abnormal blood pressure response, defined as failure to increase systolic blood pressure by 20 millimeters of mercury or more, or a drop in BP during exercise, remains a traditional risk marker, though its specificity is limited in older cohorts. Safety. Recent large-scale data, n equal to 7637, confirms that CPET is safe in HCM. Sustained ventricular arrhythmias occur in less than 2% of cases, even in high-risk patients. The 2025 ESC/EACTS guidelines have refined the role of stress testing in asymptomatic severe valvular disease to prevent irreversible ventricular damage. Aortic stenosis. The role is to unmask pseudo-asymptomatic status, symptoms during test, or drop in blood pressure below baseline. Mitral regurgitation. Unmask dynamic MR and exercise-induced pulmonary hypertension. Evaluate functional reserve in borderline LV function. Exercise-induced pulmonary artery systolic pressure more than 60 millimeters of mercury or unmasking